Diabetes mellitus. Diabetes is a metabolic disease that affects over 9% of the global population. Hyperglycemia is when there are high levels of glucose in the blood, and it is associated with diabetes. First, we will define type 1, type 2, and gestational diabetes. We will look at the risk factors and look at relevant diagnosis. In healthy individuals, when carbohydrates are ingested, the body will break them down into a substance called glucose. In response to increased glucose levels in the blood, beta cells of the pancreas will secrete insulin. Insulin will bind to receptors on target cells of tissues and organs, and this will open a channel, causing glucose to flow from the blood into the organ or tissue. Type 1 diabetes, insulin-dependent diabetes mellitus. In type 1, beta cells of the pancreas are destroyed by the immune system. Insulin production is reduced, and less insulin binds to the receptors on target cells. More glucose remains in the blood, and glucose is moved to the surrounding tissues at a much slower rate. Type 2 diabetes, non-insulin dependent diabetes mellitus. In type 2 diabetes, the body still produces insulin. However, something goes wrong with receptor binding or insulin signaling inside the cell. The cells are not responsive to insulin and glucose stays in the blood. In other words, type 2 diabetics are insulin resistant. Gestational diabetes is defined as any degree of glucose intolerance that occurs during pregnancy. Possible risk factors for diabetes. The etiology for type 1 diabetes is unknown, but genetic factors are believed to play a role. Possible risk factors for diabetes include physical inactivity, family history, obesity. Individuals with a body mass index greater than 25 have a greater risk of developing diabetes. Ethnicities that have higher instances of diabetes include African American, Hispanic, Native American, Asian, and Pacific Islander. Women who gave birth to a baby weighing over 9 pounds or had gestational diabetes during pregnancy are more likely to develop type 2 diabetes. 50% of women that have had gestational diabetes will develop type 2. Diabetes is associated with other conditions like polycystic ovarian syndrome or cardiovascular disease. Hypertension and depression are also linked to diabetes. Chronic sleep deprivation with less than 6 hours a night is also a risk factor. Therefore, maintaining a healthy mind and body through physical activity, proper sleep, and good nutrition is essential to prevention of this disease. Relevant diagnosis. When patients see their dental hygienist, it provides an opportunity to screen for undiagnosed diabetes. There are 3 main ways to screen for diabetes. Take time to review the patient's medical history, pay attention to potential risk factors of diabetes, and symptoms. There are many questionnaires like these that can help a patient identify symptoms and risk factors. When reviewing the patient's medical history, check for symptoms. Think of the 3 P's when checking for symptoms. Polyphagia, which is when the patient experiences excess hunger. Polydipsia means excess thirst. And polyuria refers to excess urination. If you are concerned that the patient may have diabetes, you can refer them to a physician for further diagnostic testing. Some dental practices do perform diagnostic tests as a preventative screening for patients who may be at risk. A sample can be obtained using a finger stick, or a sample of gingival bleeding may be used. The sample will be used to evaluate A1C, a measurement of the average blood glucose levels over the past 2 to 3 months. A patient with an A1C measurement of greater than 6.5% is an indication of diabetes. After the patient has fasted for 8 hours, fasted plasma glucose levels higher than 126 milligrams per deciliter is also an indication of diabetes.
As we previously learned, there are 29 million people in the U.S. who have diabetes, and In addition to that, there are 79 million people in the US that have pre-diabetes. Then there are an additional 7 million people in the US who are unaware that they have diabetes. Pre-diabetes refers to people who have abnormally high blood sugar levels and who are at high risk of developing diabetes and its associated conditions. One integral part of the treatment and self-management of the disease is medical nutrition therapy. Medical nutrition therapy is basically just a personalized diet to treat a medical condition in hopes to improve the nutritional and physiological health of that individual. Medical nutrition therapy can be one important tool for preventing diabetes with regards to people who have pre-diabetes. It can also be an important tool for those with type 1 and type 2 in controlling the progression of the disease and the associated conditions like heart disease or stroke. So for people who are diabetic or perhaps pre-diabetic, registered dietitians generally recommend increasing the amount of soluble fiber foods. Soluble fiber foods help control blood glucose levels. Sources of food that contain high soluble fiber include beans, whole grains, oatmeal, apples, strawberries, and carrots. Additionally, it is important that patients with diabetes are monitoring the amount of carbohydrates that they are consuming. Low glycemic foods are generally recommended by registered dietitians to patients with diabetes because these foods contain carbohydrates that are slowly broken down in the body. Since these foods are slowly broken down, this makes them important because they can steady and regulate the blood glucose levels in the body. Low glycemic foods include fruits, vegetables, low-fat milk, whole grains, chickpeas, and lentils. Lastly, diabetic patients generally should be following a diet where they consume more monounsaturated fats and polyunsaturated fats. These fats will increase the amount of high-density lipoproteins in the body, which are proven to be protective against cardiovascular disease, which is an associated condition with diabetes. Sources of monounsaturated fats include almonds, pecans, olive oil, peanut butter, and avocados. Foods that contain polyunsaturated fats include walnuts, sunflower oil, soybean oil, and flaxseed. Diabetic patients are generally recommended by registered dietitians to limit foods with saturated and trans fats. These foods increase low-density lipoproteins in the body, which increase the risk of cardiovascular disease. Foods that are high in saturated fats include milk, cream, and butter. Foods that contain trans fats are baked goods, salty snacks, and fried foods. Patients with type 1 diabetes are most often recommended by a registered dietitian to follow a diet that regulates the intake of carbohydrates to match their insulin injections. Patients with type 2 diabetes are encouraged by registered dietitians to follow a diet that meets their specific needs. There are 3 main diets prescribed to patients with type 2 diabetes. The first is the vegetarian diet, in which the diet promotes weight loss. Secondly, there's the Mediterranean diet, which is mainly a plant-based diet with low to moderate consumption of dairy products, fish, and poultry. This diet also includes moderate to high consumption of olive oils. The Mediterranean diet helps with the prevention of cardiovascular disease. Lastly, the DASH diet includes vegetables, fruit, low-fat dairy products, poultry, and fish. This diet includes low amounts of red and processed meats and saturated fats. The diet includes larger amounts of fiber, protein, potassium, and calcium. The goal of this diet is to help reduce and control blood pressure and reduce the risk of heart disease in patients with type 2 diabetes.
In the oral healthcare world, diabetes mellitus can create limitations and barriers to treatment, healing, and increase the risk of dental disease. Oral findings associated with diabetes can involve increased gingival inflammation, periodontitis, attachment loss, increased probing depth, bone loss, tooth mobility and migration, xerostomia, and delayed healing mechanisms following surgery, while overall increasing the risk for infection and disease. People with diabetes may also experience diminished taste, benign oral ulcers, burning mouth or tongue, chronic mucosal inflammation, and darkened pigmentation of the neck. Poorly controlled diabetes can increase the risk of caries related to heightened glucose levels of gingival sulcular fluid, decreased saliva, and dietary intake. Well-controlled diabetes can decrease risk for caries with regular or low sugar eating habits, meticulous dental oral self-care, and regular dental hygiene appointments. Systematic reviews suggest patients with diabetes are at a 2 to 4 times greater risk for severe periodontal disease. Evidence indicates those with diabetes have a higher hemoglobin A1C than healthy individuals. Intervention of physical activity, weight loss, and lifestyle changes may assist the management of periodontitis in addition to lowering hemoglobin A1C levels. Appointment planning for patients with diabetes should be structured around stress prevention to avoid disrupting blood sugar levels. Patients with a well-controlled diabetes status may continue with routine dental treatment as normal. Patients with an uncontrolled diabetes status may be declined routine dental treatment until the patient's condition is stabilized. Emergency care may be given in addition to ensuring the patient's primary physician is consulted. Appointment timing should be avoided during peak insulin levels and is generally preferred following the patient's breakfast and medication intake during the ascending portion of blood glucose levels. Dental hygienists can prevent and prepare for emergency during the patient's visit by ensuring to keep the appointment short, efficient, stress-free, and catered around the patient's diligent eating schedule. Additional precautions may be implemented by monitoring symptoms of hypoglycemia, treating all infections promptly, and preparing for a hypoglycemia emergency by keeping glucose gel available. The patient plays a critical role in self-management while living with diabetes. As dental hygienists, we emphasize the need to be compliant with lifestyle modifications, including healthy eating, physical activity, weight management, glucose monitoring, tobacco cessation, meticulous oral self-care, limiting or avoiding alcohol, stress management, and appropriate use of prescribed medications. 11 million Canadians are living with diabetes or prediabetes. The chances are that you or someone you love is affected by the disease, and this is the reason we must continue the fight. Donations can be made to Diabetes Canada to continue helping people with diabetes in your community live healthy lives and bring humanity closer to a cure.